my concern is that people will think psychedelics are the answer for everything, whereas they're just a tool, kind of like dreams are a tool. If there's one thing my dreams have told me, it's don't think you know everything, and dreams aren't the answer for everything.
Hello, everybody. Welcome to another episode of the Webdelics podcast, where we're on a journey to find out the truth about psychedelics and plant medicine, get rid of the myths, and change the narrative. I'm your host, Scott Mason, and with us today is an awesome guest, the one and only Dr. Darren Jakubec. Dr. Jakubec, Darren to me. It is so good to have you here. Tell us a little bit about yourself.
Thank you, Scott, and thanks. It's a privilege to be here.
Thank you.
I am a person who is practicing as a medical doctor and has for the past 27 years. I do largely anesthesia and emergency medicine, very rural medicine. I've made a career out of being very rural and started by delivering babies and having a full family practice, and have branched mostly into anesthetics, emergency medicine, mental health, including some psychedelic, and a small dream work practice where I do counseling, and a small pain clinic as well that I do with a physiotherapist. So I've had quite a varied career. And I'm still doing that, and I'm speaking out about mental health and inner journeys, and it's a privilege to be on the Webdelics podcast just for that purpose.
Thank you, and it is a privilege to have you here as well. So, Darren, welcome to the show.
Thank you.
The theme today is about an ER doctor's perspective on psychedelics and your overall health, both mental and physical. I think that anyone who just heard that theme after listening to your description of your practice areas will understand why you're on this show. But you're on this show for another reason. At the end of the day, psychedelics are medicines. They're called plant medicines as a substitute word sometimes anyway. And we have not had an actual practicing MD who works in a setting like a hospital on the show yet. I think it's very, very important that we have that perspective here. But I think that the perspective that you're going to bring with regards to dreams and the particular additional practice that you have outside of your emergency room work in the field of anesthesiology is going to be extraordinarily valuable and relevant too, for reasons we're going to get into in a very, very few minutes. Where exactly are you practicing? You say you're in a rural area. Like, is it in a suburb? Is it in a desert somewhere? Is it in a forest? Give me some context here.
So for starters, I'm in Canada, so that gives you a bit of perspective. There's certainly most of Canada is urban, but I've been in the very far north, up next to Greenland in Nunavut for my first 4 years.
Wow.
But I practiced in Vancouver, in Ottawa, Halifax to get training, and then very rural, like where I live is about 4 hours from the Alaska border in a small town, and I practice along the highway, heading along the Alaska highway. There's a number of small towns, and I've practiced in many hospitals, but that's where I'm based in mid-northern Canada right now.
Well, when you said, near Greenland, more or less, to me as a New Yorker, that automatically qualified you as an exotic. I love being able to talk to someone who is from a part of the world that I have never visited nor even imagined existed in my entire life. And I hope it's not too annoying hearing an arrogant New Yorker say that.
Not at all.
So talk to us a little bit about your anesthesia practice and how that relates to psychedelics. Am I correct in assuming that the psychedelic that it most familiarizes you with would be ketamine, or am I just imagining things here?
No, absolutely. And I'll give you a bit more of a tangential answer here. I think it's the anesthesia part. So backing up a bit, I got quite frustrated with a lot of healing or how I actually help people in medicine. And I came to the conclusion early on that people either need actual surgery, either the baby's stuck or the bone is broken, or they need some level of psychological slash spiritual surgery. Um, and they need some sort of intervention. And if I can help in either intervention, I can make a difference. So I went into anesthesia feeling I could make a bigger difference because in my practice, it was something that was really needed in my region. And it just so happened that I got familiar with ketamine and got familiar with resuscitating people. And with my emergency room practice, I saw a lot of psychosis and a lot of mental health. So between knowing medical side effects and knowing psychiatric, seeing some of the worst psychiatric side effects, I felt I was in a good place to start with ketamine as a dissociative psychedelic agent, as a place to start, and it's legal. So I'm still I'm still practicing. I still have a license, and I have to abide by the rules to the extent that I'm credible and doing the right thing within my licensing authorities. So ketamine's legal.
Right.
Yeah, so that's where I've started.
And when you talk about ketamine as a dissociative agent, can you explain in layperson's terms what that means? Sometimes these $5 words, they just overwhelm my little mind. I just can't help it.
Yeah, I use that word partly to introduce, and I think this won't be long. I tell people look at ways in which their mind can be affected. There's medicines, and then there's um, street drugs, for lack of a better term. Something like methamphetamine or cocaine, they're uppers. They elevate you. Something like an opioid or fentanyl dilaudid alcohol is a depressant on your entire system. And then there's these middle categories, which I think all psychedelics fit into, which I call dissociatives. And certainly some people have used this term. It's not universal by a long shot, but they can both elevate you and depress you. They can release all emotions. So they take you out of your current state of being and give you a different perspective, if that's
Well,
awkward wording to it, but
yeah, no, that actually makes sense. And I suspect a lot of the folks listening to or watching this may have generally kind of suspected that that's what it means, but I always like to get clarity on that because half the time I think I understand something and I really don't understand it at all. It's embarrassing. I've had a lot of embarrassing incidents in my life, but fortunately, none of them have led to the sorts of emergency room visits that you probably have seen that led you to begin to get more deep in your thinking with regards to mental healing as opposed to just fixing a broken bone, which again, of course, is an essential part of emergency room practice. But I'm gathering from what you're saying and just sort of thinking about it as a matter of common sense when it comes to things like drug overdoses or suicide attempts or extreme depression. You know, actually, I lied a minute ago, Darren. When I was younger, I actually had an incident in which I went to the emergency room because I was on the phone with my mother and my lower right leg started to blow up right in front of my face. And when I went to the emergency room, they did a medical history on me. And I've discussed this on the show before, but I've never discussed this exact incident, which is during that I revealed that I was heavy duty doing steroids to support my weightlifting addiction, for lack of a better word. And this leg blowing up was a symptom of something going terribly awry in my body related to that. And when I think about it, getting all jacked up on steroids, being as obsessed with weightlifting as I was, actually was symptomatic of an illness that was spiritual or that was heart based. And that did ultimately lead me into the emergency room. So when I think about that, I can really relate to what you're talking about. how did you come to then say to yourself, well, maybe the ketamine that I am using in my medical practice could be applied in a different situation? How did that really tie into how you began to change the way you viewed yourself and how you interacted with those that come into your hospital or other medical settings?
Goodness, there's a lot of questions there in a way. I think that just for perspective, I'm in my 27th year of practice. It's just the last 3 years I've been using ketamine as a psychedelic in my practice. So it's by other means, and I'll say I like awkward wording, just to say you're not the only one that searches for words, and once you go into I use the words outer journey and inner journey a lot, just to help give a framework for the conversation, and the psychedelics help open up that inner journey, but there's this crossover. It's like this conversation is actually happening. This is an outer journey thing, but we're all living an inner journey, which shows up in just awkward terms, psychological and spiritual. And once I started seeing this and trying to talk about it in a grounded scientific way, it was about 3 months after that I thought, goodness, people are having this inner journey, and I didn't know how to talk about it. And I had a dream where ceramic words are coming out of my mouth and I'm smashing them with a baseball bat because nothing that I was saying made sense. So you're not the only one that has trouble. The inner journey defies words in many ways, but and I saw it in my family practice and in my emergency room practice. You see mini crisis in your family practice and big crisis in the emergency room, and you realize a lot of it's psychological and spiritual, and what are the tools we have. And it's very late in the game that I've seen excuse me, psychedelics and ketamine in particular, which is the legal one in my domain, as a possibility. And I personally didn't have, I've since had a bit more exposure to it because I believe you have to walk the walk. So if I'm going to do this, I better do this myself. And I think it's particularly true of inner journeys that I can't speak of this unless I'm doing it. And unless I'm going into my own inner journey, I can't comment on this. So, but it became apparent that if we ignore the inner journey, what somebody's going through on a psychological slash spiritual slash beyond words sort of level, they get in their own way and they sabotage themselves in a way that's unique to them. For me, it would be workaholism. I've had my own domains and my own demons I've had to deal with, and I still am doing my own inner work. And I've seen the difference in myself and those around me and those that do inner work. I've seen their health change on an outer level. Their marriages change, their relationships change, their addictions fade away as they do inner work. And psychedelics is one modality to accelerate that work, if that makes sense.
It does, and I can so relate to every word that you just said, Darren. You know, this emergency triggered a lot of inner work within me. And you're right, my marriage, my work life, my physical state all have grown, gotten better, become more true to what I believe they're meant to be due to that inner journey. I used to have rosacea all over my face during this period. Now you look at me. If you're just listening to the show, maybe you need to go to the YouTube channel just to look. My face is clear. That's just one minor example. But I want to hear more about your story. You said you can't talk the talk unless you walk the walk, and that you chose to do the work yourself rather than just sit as an authority on high. What triggered all that, my friend?
I knew there's a blessing and a curse of having some trauma in your past. I had a pretty unsettled childhood. And I almost knew early on, it's like, wow, I'm going to need to see a therapist someday. But people, it's amazing how resilient humans are. It's like if we have a roof and some food and parents that didn't overtly beat you or sexually abuse you, you know what, I'm doing pretty good. And compared to X and Y. But I could tell I always felt unsettled in the world, and felt a draw to, I church hopped, and before, nobody role modeled me going to a counselor, traditional counseling, which eventually I did. So I've always been searching for why I feel so unsettled. And I could put identifiable factors on my childhood. My mother had a schizophrenic break pretty early on, and she saw the other side, whatever that meant, gave money away to mega churches, and my parents split up. And we muddled through, and thankfully, at least my father said, make sure you get good grades. And that's, and I took that to my advantage, and went ahead, but I was barely functioning on many levels, and I drank too much, and there was many little addictions that I had that I was always in a state of low level trauma, low level PTSD, it felt like. So I just kept searching and searching, and there's many ways to access an inner journey, and I think this is really important to say, and especially on this Webdelics venue and platform. If we talked before that if there's a message that you can access that inner journey in so many ways. And I tried, organized sports can bring out emotions. What brings out emotions? Music can bring out emotions. I listen to music. I've only recently started playing. But between counseling, this and that, eventually I went to a dream work retreat, not knowing what that was. And it turns out dreams speak to me, and I have a dream work therapist. And that's been my main modality of accessing my own inner world. And that I still have a dream therapist in the state of Maine. I call him up, email him my dreams, and Bill talks back to me and reflects and mirrors back. And it's one of the ways I access my inner journeys, and it's got a great language that crosses over. So that's how I got into this. And then, of course, I'd project my issues onto my patients and see that, goodness, if I can get over this, maybe some of them can get over this. And if there's one thing my dreams have told me, it's don't think you know everything, and dreams aren't the answer for everything. It's like I went through my stage like a Christian who would find Christ in that church and that modality. Right. And that works for some people. And I thought dreams were the answer to everything. And my concern is that people will think psychedelics are the answer for everything. Whereas they're just a tool, kind of like dreams are a tool. Does that make sense? That's a lot.
It makes sense, but it sort of reminds me of what you just said to me, which is that there was a lot within what I said, but there was a lot within what you just said. So let's start to unpack it, roll up our sleeves, and dig in the dirt and pull out the meat of this conversation, because there's a lot of meat there. First of all, this is the second time during this conversation that dreams have come up, and I'd like to explore them a little bit more. You said earlier that you had a dream about words coming out of your mouth, if I recall correctly, and they were ceramic, and that they were breaking and shattering. And those sorts of imageries really resonate because there is a symbolic element to them. There is a highly visual element to them. It is as though a certain part of our subconscious or something somewhere else is attempting to speak to us through this language that can't quite be accessed through words. And that at the same time requires us, in order to interpret and absorb and benefit from the message, to exercise our intellect and our emotional intelligence in order to grasp what it truly means. You're then talking now about therapy using dream work as a way to help you on that inner journey. And, you know, as you hinted at earlier, the inner journey work is a journey that goes as to a place within every human being that language can't even begin to touch. When we've had guests talk about psychedelic experiences, as someone who was new to this world and just learning about it, I have to say the descriptions of their journeys aren't exactly like dreams, but they do seem to have similar symbolic and highly visually driven allegories in terms of the communication mode that they represent to those who engage in those journeys. Can you talk to us a little bit more as someone who has engaged in both modalities, how they're alike and how they're different? If I'm having a lot of dreams, why would psychedelics be a modality that I'd even consider?
I pause. I've thought a number of times of writing a book, and I'd have to put the little disclaimer at the start of every chapter that I don't know anything absolutely. And I know that you know that, but there's trends, and I get very excited when I work with people who describe their visions, because I've worked with so many personal dreams and so many people with dream clients, and I've either co-hosted or co-facilitated a number of dream work retreats and been to a number and seen other people's dreams. So it's a very much a part of my world that I feel like I've learned the language, and it's the same language, and but you have to hold that language lightly, and you realize each person, there's trends, but each person is so incredibly unique. So that language, give an example of a sword might come in a dream or an image, and a sword is often a symbol of something. It's similar to a gun in a way. Can you defend yourself? Can you be aggressive? Are you okay fighting in this world? And you might say, oh, there's the symbology. But I had a client who was gifted a scabbard to put their sword away because they always had it out. And you might think it's good to have a sword, or you might think it's good to be in water, but if your brother drowned at age 6, maybe the water holds a different, or if you avoid yourself by going to the water, or everything has an on and an off. So holding everything lightly as you learn these languages. But I found having the language of dreams and mythology really, really helps you navigate with others as they go through and come out of psychedelic experiences, particularly what I will roughly call dark. I don't like the words good and bad. People find something painful, scary, or dark bad, and it's just true, or there's just something we need to see about that. And to help hold people's hands, it's like, yep, that's dark, yep, that's sad, yep, like there's nothing to say there. Or just to be with people when they find that dark space is something that I found, if I hadn't been doing my own inner work, I couldn't be with that person. As a doctor, I'd try to give them a pill, here's some Prozac, and try and get you out of that dark space. But once you've walked the walk and realize, yeah, there's darkness, there's light, but there's darkness, and to pick two awkward words, you can use that same crossover language between both journeys, and it's been extremely helpful. How's that for an awkward answer?
It's awkward in that, like we said a few minutes ago, language doesn't always capture the nature of the experiences that we're talking about here. You mentioned mythology, for instance, which is one of my favorite topics in the whole world. Mythology, when many people were growing up, they just sort of assumed were these old stories that were just designed to bore people in high school, when really they're very, very rich in symbolism. And by the way, priests and priestesses in the more classically oriented mythical traditions had something of a similar role to the shamans that you see playing a large part in the psychedelic tradition, and in fact are a major modality for how people engage with psychedelics and their psychedelic journeys even today. And so we're talking about a whole range of different modalities that people can use for inner work that use similar language, but that bring different entry points to those who need to go on that journey, at least as I'm understanding it. Again, am I understanding a word that you're saying correctly? Then B, if I am, I would love to hear what might be an appropriate entry point for someone who is interested in going on this journey that might work for dreams or psychedelics versus each other? Or is it one of those things where you suggest, if you're needing to go on this inner journey, that you merely explore a whole lot of modalities and come into the right one? Or is there something else behind entering into this journey that you think we should extract from this conversation as it's moving forward? I hope that wasn't too simple of a question.
Where does
I need
one
to get myself under
start?
control sometime with these questions. Jesus,
But it's an important question. But thank you. It's an important question. I'll give you my ethereal sort of answer. It's like it's very the Buddhist language is very helpful. It's like, well, just start. Just go with what is near you and what the universe presents to you. And I'll give you my medical doctor answer, which is book an appointment to see a counselor. And traditional counseling, and there's, like any profession, there's good counselors and there's phenomenal counselors and there's mediocre counselors, but counseling as a general term would be the baseline societally accepted way to go into an inner journey other than religion. And for those that a church, absolutely, all of the spiritual language opens up that inner journey language. And those are two common Western society ways in which to start this journey, which is what I might say as a medical doctor, like what are your supports? But realistically, the list is endless, from yoga to Tai Chi to meditation to sports to like whatever brings, I'd say, relationship, knowing that there's a relationship support, a shaman, whatever that, a priest, a counselor, and finding a way in that works for you. But I would, one of my missions within the existing medical system is to start with the counselors, have counselors, psychologists, psychiatrists, which are the medical trained psychologists or with the MD behind them, family physicians, emergency, have the integration into the system where we can talk about inner journeys, and then have a tool like psychedelics, and psychedelics in particular, that we can use after somebody has accessed this, has a bit of a language, has a support team. And when I particularly have the psychedelics for my own clients, I'll treat, there's a lot of preamble, treat it as a ceremony with supports before and supports after, because you can open up a lot of dark material. People can get suicidal. They can face things that they didn't want to face. And suicidal behavior can be an addictive sort of behavior, kind of like alcohol, kind of like working out, kind of like sports, kind of like any sort of other addiction. So have supports, although you need to do it alone. It's an individual decision to do inner work, and you can't force anyone to do it. If you're going to do it, have supports. So all these answers seem somehow awkward, Scott.
I think that, again, we're talking about stuff that is difficult to wrap language around, and being honest about that even. When I hear people talk about their psychedelic journeys on this podcast, sometimes I feel like I really am grasping only a sliver of what they really experienced. I don't always feel as though I'm able to truly comprehend the fundamental nature of the journey in a way that I might, as if they were saying something like, well, I saw these big, tall, gray mountains with white snow caps and clouds above them on the left side of my car when I was driving from point A to point B. It's a fundamentally different linguistic approach that needs to be taken. So I don't necessarily see this as awkward as much as an underlying acknowledgement of the limitations of the physical tools that we have to express an experience. Let me ask you this. With the psychedelic renaissance leading to increasing decriminalization of psychedelics, and in other situations, outright legalization, even if it is just within the context of a medical prescription, as recently happened with psilocybin in Australia, I believe. Where do you see the medical establishment, frontline doctors like a primary care physician or an emergency doctor like you, utilizing these sorts of tools in your therapeutic toolbox, or the next step recommendations that you might make for patients who come in through the doors of the medical establishment that you're sitting in?
Goodness. For starters, in a way that offers support, which our medical systems around the world do to varying good and bad degrees. So seeing them as a tool, and if you are going to use them, offer support around them. And right off the bat, I could see how they can be overused and seen as the panacea or the god, or this is the next Prozac or the next whatever, that the next even bigger, the god sort of, this will be my answer.
Right.
And let's not treat it as that. Let's treat it as a tool by which we can help people open up to their inner journeys and support them. So my personal vision is that we use it as part of an integrated health maintenance and health promotion tool. And I think, I like to hope there's enough people thinking similarly to myself that can be part of those systems. And albeit I'm in rural Canada, I feel like I'm having a voice larger than my small hospital, because I feel I need to. There's not that many people that are doing this sort of stuff, and I was the leader in my region to do it. And hence even talking on the Webdelics podcast, I think we need to integrate outer and inner. We need to find words as best we can and find programs as best we can, because this is such a potentially potent and valuable tool that very brutally, I could see a number of people doing this, having what they call a bad trip, or opening up to some of that darkness I speak of, some of the, say the word demons with apprehension, shows up in dreams as demons, but opening up to some very difficult emotional subject matter and committing suicide, and how that can very quickly give this modality a bad name. And the press and the media, okay, it's out, because like any modality, you can overdose and not be grounded, and a certain percentage of people are going to commit suicide no matter what we do. And it's very sad, but this has been blamed and will continue to be blamed on any modality. But psychedelics, I find, are I would suggest, are particularly susceptible to a subset of the people that do these committing suicide, if it's just broadly thrown out there without support. But I know one of my personal addictions has been to think that I can save people. So as karma would have it, or fate would have it, I go into a healing profession where I have to have some sort of healing capacity. You can't save everybody. So, and everything has its risks. So how do we implement this into broader society? And the shamans know, right? They know. You have a container, you take time, you take days, you take a few days afterwards, because you can feel extremely ungrounded for a few days and do rash things. And we have this thing after retreats, in my dream work retreats, and even I've implemented this. Now is not the time to make rash decisions. Maybe don't divorce your spouse. Maybe don't quit your job. Maybe don't jump off that bridge. Maybe don't, because it can really shift people's reality. and I'm going beyond the question here, but I can see a difficulty integrating it into the system unless we do it properly. There's my summary.
Yeah, but that actually did go as to the fundamental nature of the question and what I was really asking, which is to the extent that this becomes a more accepted place that physicians can go when they are faced with the patients in the right circumstances and who might not have otherwise other sorts of conditions or issues that may keep them from even being able to credibly use psychedelic therapy. Okay, that's great. They have this new tool, but what are the spaces around it that can prevent these things from happening? Let's talk briefly about a subject that you touched on, but I want to make sure that we dive into more deeply. It came up earlier in the show, but it has resurfaced again, and that is the idea of psychedelics and the inner journey as relating to physical health. Again, we're going to leave aside accidents. Accidents aren't really relevant to this if the accidents happen to you, although sometimes even accidents aren't really accidents, so maybe that statement was a little bit broad. But as someone who is in the emergency room space, am I hearing you say that if we had a larger space for people being able to use all available tools to go on this inner journey, a lot of the emergencies that bring people into the ER might be prevented?
Oh my goodness, yes. Yes, any emergency room physician, nurse, assistant will tell you the same, that we have so much just from substance abuse, be it opioids, fentanyl, dilaudid, whatever the flavor of the day, crystal meth. It's just that alone, and people just simply falling down or having little traumas or overdosing or choking on their vomit. Just the number of ambulances from overdoses itself, just purely psychological, and always psychological / spiritual. I would say this. They're having a crisis of, we call it mental health, but truly I think most people who would listen to a program like this, there's this psychological, spiritual aspect that they're in crisis. But whether it's a physical domain, kind of going back to your question, other presentations that manifest physically, one of the unlikely best-selling books of the past 10 years is The Body Keeps the Score.
Yeah.
And just the title says it all. It's
Yeah.
kind of an awkward book. It's a bit of a brutal book. And then there's When the Body Says No is another popular book that just, even the title of those books, that the body manifests things. And I see this in my pain clinic. And it's not entirely true. But if you don't deal with your psychological, in brackets, spiritual issues, they so often manifest physically. Not only panic attacks, chest pain, just pain everywhere in your body. There's emotional pain that manifests physically, and that shows up in our systems. That shows up in the emergency room, and it's not entirely true. Like maybe that pain is a gallbladder, so you have to tease it out. And when I hit a dead end in my emergency room practice, I might ask people to dream, but to have another tool, somebody that's hit a dead, that's tried 3 different antidepressants. They've tried electroconvulsive therapy. They've tried different churches. They've tried X practices. They've been to a counselor. The hope of something like psychedelics is that it's another option, and that can bring people out of the pattern that they're in. If they're in for suicidal ideation, they just have suicidal thoughts. One of the big breakthroughs, I think, from early studies has been psychedelics can be quite quickly effective in breaking people's suicidal patterns, and that those people come into the emergency. I mean, it's obviously an effect on their life, their family, but from an effect on how do we treat people, how do we facilitate people to have a better life. Psychedelics have been particularly good in getting rid of suicidal thoughts for the first 2 or 3 weeks at least, until you can open up another door. And most medical practitioners will be honest with you that by and large, antidepressants they keep people functional. There's a subset that do very well on them, but so many people, they've just numbed themselves and they're functional, but they're not thriving. They're surviving but not thriving is a cliche term, but it's particularly with the antidepressant class of medications. We see people that are really not manifesting or living life to their fullest. And when you don't exercise, when you're like your body will break down. You will get back pain if you don't. If you're not motivated to get out of bed, eventually your back's going to hurt. If it's all you can do to get the laundry done in a day, good for you. But chances are your back's going to start hurting. Chances are your body will break down, and that's going to show up in your overall health. And I've just picked a few little small examples and tried to relate it to how I see it in the emergency room. But big question once again, and it's, did I answer your question?
Absolutely.
Did I answer your question, Scott?
Absolutely, above and beyond what I would have ever imagined. And that's why this conversation has been so rich and fulfilling, and why I think it will really speak to people. Darren, if there is one takeaway that I could pull from this conversation, and heaven knows it's hard to just pull one, but if there is one that I could take, one thing that I could say about it, it's that when booking you for this show, and I bet a lot of people, when they look at the title of this episode, might have thought the same thing. I suspected that your feelings about psychedelics as an emergency room doctor would be no, 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 wrong, don't do it, they're drugs, this, that, and the other. You've really surprised me, and surprised me not in that you are not that rigidly opposed to them, as much as the nuance within which you understand them, and the relationship that you are pointing us to between the physical ailments that you deal with every day and the underlying spiritual or psychological or other causes that may be able to be solvable if this one additional modality is available to people. I also just have to say, before I turn this over to you for your own last words, nothing, and I mean nothing, breaks my heart like hearing that someone is living a life in this numbed state. Because at its best, once you've gone through an inner journey, you can appreciate and understand the full richness of life. What an incredible thing for someone to not get to experience. It just makes me so sad. And so thank you for pointing that limitation of the existing modalities out, but indirectly pointing out opportunities that other modalities, at least possibly, can present. If there is any one takeaway or last word that you'd like to share with the audience before we leave today, Darren, what might that be?
Keep, on an individual level, we can't help others until we help ourselves. So whatever your modality is, to look within yourself, do that. And if psychedelics happen to be a part of that, make it only a tool on the side. Don't make it your primary way of being in this world. Seek in a way that the spiritual traditions speak about, and that will help your overall physical, emotional, and relational health in this world. Yeah.
When I was in the emergency room for that leg condition that I talked about earlier, my doctor later advised me that if I had not taken care of myself quickly, stopped the steroids, stopped all of the eating that I needed to, stopped the obsessive weightlifting, if I hadn't done all that, I might have lost my leg within 2 years. There's no coming back from something like that. What you're talking about can really impact people's lives, and I can only imagine how my own life might have changed had such a modality been available to me then. Now, for those of you who may want to follow up on Darren's advice and reach out to me, well, an easy way to do that is by going to the Webdelics website. That's webdelics.com. webdelics.com. If you go there, you'll be able to sign up for our newsletter and get up-to-date, credible, curated information about psychedelics and plant medicine from a source that you can trust. If you enjoyed today's conversation, I ask that you tell everyone that you know about the Webdelics podcast and share links to it so they can watch us on YouTube or follow us on their favorite audio platform. By the way, if you're listening to this episode and enjoyed it or watching it on YouTube, be sure to subscribe to the show, and then on YouTube, leave some comments. And if you're on an audio platform, by all means, leave a 5-star review. We love to hear from people and connect with them that way. In addition, be sure to connect with us on our various social media platforms, Instagram, Facebook, LinkedIn. Connection is what plant medicine, psychedelics, and Webdelics are all about. Above and beyond everything else, be sure to come back again for the next episode of the Webdelics podcast.